So if we go back to co-production, so we're about to start a project exactly in this area. And you have options when you're about to start something. You can overthink and you can come up with your plan. Or you can convene people who have lived experience, people who have tried projects and learned, people whose minds are in this place and thinking what's the best way. And you can create an environment where they feel able to talk to each other, and then we all feel able to test some things together. And the addition that an AHSN brings to that, as well as holding that space, is that we also have some great teams with access to data. So population health management is a new jargon word for what we used to think of as just public health. It's really understanding the people in your community at a level of barrier and challenge. So if we use our data to go, who is not coming and what do we know about them first? What are the clusters and the patterns? Okay, so now we've understood that there's a group of, let's say, men between 20 and 35 who routinely are not using GP practices, but when we hear about them, it's too late. And this could be connected to suicide. Okay, well, what's our appropriate approach to outreach? You've really got to consider that before you start doing it. And what we've got to do is we've got to go, what have we done in the past? And what's currently not working? So medicalized approaches, blanket contract approaches, putting people into roles without the support around them so that they aren't, when they go to meet with people and they are faced with the complexity and the challenge, they themselves are overwhelmed, giving them too much workload, all of these factors, and go, okay, well, as we design this, let's try and design those things out at the start. We won't get it all right, so let's have somebody with us at all points, learning with us, and then let's reflect. Now, what that is, that's going to annoy some people because it's going to slow everything down. But our problems are too big to carry on rushing ahead doing the same stuff. So that's what we seek to do in our local work, is we hold the space for long enough to allow a different approach to happen that makes the most of the different voices.